South Australia has moved quickly in terms of testing. It's put itself in a very good position in regards to case numbers. The state total is 439, but there are no active coronavirus cases left in South Australia. The last recorded case was almost 2 weeks ago. The case before that almost a month ago. So now the Premier says the biggest risk for South Australians comes from those entering the state, and he wants to try and shelter the state as best he can from interstate outbreaks. Now, it had previously looked like the state border would reopen when the third tier of restrictions is lifted around July. It now sounds like it could be much longer than that. The Premier told local radio this morning he thinks the border will reopen sometime this year. He backed that up a short time ago, but refused to name a time frame.
Nobody's got a crystal ball. In fact, if you had have asked me 4 weeks ago, would we be here today, I would have said not a chance. Look, really, South Australia has done extraordinarily well, and so has the country. But there are still new cases being reported interstate every week.
Now, that is at odds with the Tourism Minister Simon Birmingham. He has said that states that are on top of this virus, that have low case numbers, should consider reopening their borders. He said states that drag their feet on this will be costing their tourism economies. That's a comment the Premier says he doesn't agree with, and a second wave would be far more costly.
If we continue to see the national success in containing COVID-19, as things like restaurants and pubs reopen and we get things gradually back to normal with appropriate social distancing, then there's no reason, if all of those next steps are successful, that we can't see borders reopen well before September.
Now, restrictions, as they have begun to ease here in South Australia, SA Pathology says it hasn't seen a reduction in COVID-19 testing. It's still conducting around 1,500 tests each and every day. At the moment, anyone with cold or flu-like symptoms is eligible for testing, but the government is opening that, expanding that to target specific groups. That includes healthcare workers, aged care workers, the homeless, prisoners and truck drivers entering the state. But Ash, officials say they won't consider compulsory testing for anyone entering South Australia, even if that did mean getting the border open sooner.